Thank you, Susie. As Susie said, we're now moving into a series of 3 short buzz talks that will be delivered by members of the First South Bank team. We don't have time to present the findings from all 10 of the evaluations we've done over the last 5 years. Instead, we've chosen 3 that reflect the range of interventions we've worked with. Each one will give a snapshot of what the issue was, how we approached it, and what we learned. First up will be Professor Jane Wills. Jane will talk about our evaluation efforts to restrict advertising of high-fat, salt and sugar products across a region of England. Then Dr. Gemma Bridge will present an evaluation of a mental health programme for young people. And finally, Tom Mills will talk about our evaluation of the Communities Against Gambling Harms in Greater Manchester. They've been given just 6 minutes and 3 slides. A big challenge for your average academic. But they will also share a QR code, so if they've sparked your interest, you can look at the full range of outputs we've produced for each evaluation, including research briefings, animations, and academic papers. Jane, over to you to start that.
So this is one of the first, well, it was the first evaluation that we conducted. There is a very detailed and lengthy academic paper that you can follow up and have a look at. We conducted an evaluation in a region of England, so it included a lot of different types of councils within it. Which way am I going? The issue here is that we know that there is extensive evidence that advertising does influence behaviour. And in relation to high-fat, sugar and salt foods, as was the focus at the time, we know that it can act as a brand awareness for young people and children, that it can be a cue, it can influence preferences, and we also know that local governments control an enormous amount of advertising space in the outdoors. Billboards, posters on buses, bus shelters, and so on. Transport for London, as you may know, have banned the advertising of so-called junk foods for several years, and some local councils are also trying to restrict this. We know the London School of Hygiene and Tropical Medicine evaluated the impact of the Transport for London restriction and suggested that it had greater impact than the soft drinks industry levy and watershed restrictions, and have identified that it impacted on household behaviours fairly significantly. However, it's not an easy thing to do. And just recently, the BMJ published a paper showing freedom of information requests from 52 local councils who had been lobbied by industry to suggest that as they were in financial crisis, how much they would lose by trying to restrict advertising of this particular product. So knowing that it was difficult, we were evaluating how the region went about trying to do this. As James pointed out, our evaluations are short term. They're a year or 18 months. So we weren't able to look at the effect of any changes that they introduced, but we were looking at how they went about it and what were the challenges in so doing. Over the 12-month period, we collected data on what was the current situation in all of those local councils. We collected a lot of qualitative data from those involved in trying to seek the change, elected members, but also particularly policy advocates, people in public health. The region had set up a community of improvement or practice across the region, and Sustain, which is an external charity involved in lobbying around dietary change, and particularly the advertising in relation to that, were also involved. And what we learned really three sort of areas of learning. One is, in trying to restrict advertising of these kind of products, we're trying to address what we call a commercial determinant of health. The strength of the food lobby is very significant at all levels. And so when you're trying to make that change, a council will be subject to challenge. And so what we found was that the way in which councils were most successful was if they took a staggered approach. They didn't try to introduce policy change straight away or in one leap, but they had to work gently to try to get more and more stakeholders on board, manage the resistance, and build the robust case. One way of building the case is about how you frame the issue. And so what we found was that one successful way of framing the issue was in relation to healthy weight, rather than we're trying to challenge advertising of such foods. So it was linked to previous objectives. The financial crisis, which I mentioned, was a challenge for all of the councils. They were extremely concerned about what the impact of this would be. And so looking at the data that was available to them and how they were using that data was also a key learning. A very interesting thing from our point of view, Susie and I have long worked on public health workforce development, was how the members who worked in public health departments did not feel equipped to tackle this issue. They didn't feel they had advocacy skills. They were worried about how to do it. And there was considerable need for, this should be an initial training. We need to have specific targeted support for this, and a named policy advocate is crucial. The region had set up a community of improvement, which elsewhere might be called a community of practice, which is becoming increasingly widespread. We may previously have had shared networks or learning networks and so on. They're now called communities of practice. A chance for people to talk about how things were going, to reflect on what they were doing, think about the challenges, and we found in the evaluation that they really welcomed that. There was good attendance, good engagement, and they found it incredibly supportive. And then finally, my final point is that the involvement of Sustain as an advocacy group was also very important in this evaluation in helping them through it. So it's a short-term evaluation looking at how a council is trying to implement an intervention. And we were looking at the ways in which they were doing that and found some very important aspects of learning that we hope to take forward.